Is this just a speech delay, or could it be autism or ADHD? As a mom to a son with autism and as a behavior analyst, I know how confusing and emotional this journey can be. My own son, Lucas, started with a speech delay that turned out to be autism, and we had no idea until he was almost 3. Back then, we didn't have Google or Facebook or easy access to resources, and actually, he looked pretty good at 18 months and 2.5. He just looked like a quiet, speech-delayed little toddler. He even attended a toddler preschool class twice a week on his own for a whole year. He didn't stim at all. He didn't have any separation anxiety. He didn't have any problem behaviors. He was no problem in the class, just quiet and kind of in his own world. When you're trying to decide if it's a speech delay or autism, I'm going to give you 5 things to look for. First of all, pointing. A child should be pointing, and pointing a decent amount by the age of 18 months old. Children should be pointing to both request things and to show you things like an airplane overhead. But even if a child is pointing, that does not mean it's not autism. The second way to assess is to assess not just their spoken language, which could be delayed, but also their understanding of language. Can they touch their body parts, follow simple directions without you gesturing? Can they throw this in the trash or come here without you waving on? The third thing you can assess is play. Observe their play. Are they only interested in one object or repeating certain activities like spinning things or stacking things or lining things up for an extended period? Number 4, assess imitation. Do they imitate actions like waving and playing with toys, which is the way most kids learn language and play skills. So kids without imitation skills, that would be more likely to be autism versus speech delays. And the 5th thing you can assess is behavioral outbursts. Notice if they not only show these repetitive behaviors like spinning and stacking and lining things up, but they also tend to have bigger meltdowns or tantrums or whatever you want to call it. So you can assess all of these things. You can also use my digital assessment, which is still free for a limited time. More than 50,000 people have taken this assessment, and you can do it within 10 minutes. Parents, lay people, and professionals can complete the assessment. It's called the Barbera Early Childhood Assessment. We have the acronym BECA, BECA, and you can get that assessment at marybarbera.com/assessment to really get a gauge of your child's strengths and needs. It's not going to say whether they have autism or not, because you know what? Quite frankly, it doesn't matter at this point. There is a lot you can do with or without a diagnosis to increase talking, decrease tantrums, and improve picky eating, sleeping, potty training, and more. Start with the BECA, get the link on or around this video, and take action today. I hope to see you in my world very, very soon.